is for training purposes in TV news education. Some copyrighted material is used and is credited on screen. However, no more was taken than was necessary to tell the story of the event. YBA claims fair use of material.
Thanks, guys. I'm Evan Berkowitz, and what if I told you that more high school students report using marijuana today than report using cigarettes? Well, they do, and the difference is by more than 10%. This information all collected from the recently conducted Massachusetts Youth Health Survey reported by the Mass Department of Public Health. And two of the main authors of the survey are here joining me in studio today for an in-depth interview about some of the most pressing issues facing our region's teens. Please join me in welcoming Ms. Diane Gonsalves, an epidemiologist for the Mass Department of Public Health, who created this report, and my other guest, Dr. Helen Hawk, who helped oversee this process. Ms. Gonsalves, Dr. Hawk, thank you for joining me.
Thank you.
Thank you for having us.
Thank you.
And I guess we'll get right into it with what I mentioned in the lead. In your survey, you reported that more high school students are using marijuana than are using cigarettes. Do you think they're more easily available? Why do you think this occurs?
I think part of the reason may be availability. I know, marijuana isn't as easily regulated, but also marijuana is the most commonly used drug among students, across the nation. So it's not surprising that it is higher, and I think there's been a lot of new regulation surrounding the sale of cigarettes, and it, hopefully is making it harder for kids to purchase cigarettes. So that may be a reason for the difference.
Anything?
Yes, I think that it should be part of it, because cigarette smoking decreased drastically, and also there are many regulations which make buying cigarettes and other type of tobacco much more difficult. So that could be one of the reasons. But I would add that our data shows that actually kids started to, those who use it, they started later,
Wow.
which is actually good news. So that it means that teenagers probably understand how bad it is. They start later. If they do, they start smoking later.
And Governor Patrick recently signed a bill lowering sentences on nonviolent drug offenses, among other things. And also, a couple years ago, the legislature and the people of the state voted to decriminalize amounts of marijuana under 1 ounce. Do you think that this will contribute to additional drug use by teens, or what?
I'm not sure that it would really increase. Personally, I think that if kids want to smoke marijuana, they would be able to find it. And I would hope that this, it wouldn't increase the amount of kids that are using. That's my opinion.
All right.
Yeah, I agree. Yeah, I do not think that legislation did something to that trend. Yeah.
And also onto a different issue, the issue of nutrition, which you also focus on a lot in your survey and report. The state has worked hard recently to retrofit its public school lunch program. And you also found that in middle school, more than half of students are eating 3 or more servings of fruit and vegetables a day. Do you think that this is proof that the state's work has worked, or is it just a sign of people realizing how to be healthy?
I think there's probably a couple reasons. I definitely think that the school lunch program is helping, but beyond schools, we have to look at what kids are eating at home as well. But I think it is very promising that middle school students do report eating more fruits and vegetables than high school students. But another aspect to that is that for middle school students, it may be harder for them to remember how much they've eaten.
Yes.
So we hope that they're answering correctly, but that, there is that chance.
And you mentioned answering correctly. Maybe answering correctly because they're forgetting, or with touchy subjects like drug and cigarette use. How do you make sure that students feel confident and able to give correct, truthful, honest answers to this survey, because if it's truthful, it's more useful for all of you. But with some of these issues, they may be reluctant to give the true answer.
Exactly. That's probably the biggest limitation. One of the biggest limitations that these surveys have is that, you know, a lot of kids may be, you know, afraid to answer or think they may get in trouble, and also they may be more likely to answer yes to, you know, positive behaviors, that they want to set a good example and look like they're taking care of themselves, not doing bad things. So that is always a factor that we have to, you know, to take into account. But also the survey is completely anonymous, and we tell these kids is, you know, the data will, you know, will not be distributed. They will never be, you know, they won't know.
Who's who?
Yes, that's a big factor, because we actually, kids know that it's totally anonymous, totally, and that helps. Yeah. Also, it's a matter of sample size. We have a big survey. So, you know, if you ask all across the state, if you have a big sample, so it's less a chance that you may collect not accurate data, and that's important. But self-reporting, always, whatever you do, every survey, if you ask adults, if you ask likely voters, or whatever it is, you know, every self-reporting has limitations. So the way of doing that, increasing sample size, is very important here.
In the survey, you found that students were more likely to report alcohol use if they believed their peers also drank. You're an epidemiologist. Do you see this as an epidemic, this drug, tobacco, alcohol use, or do you see this as spreading in that fashion through this peer pressure?
I definitely think it's probably spreading through peer pressure. You know, the results were shocking, but also I wasn't that surprised, because I know, you know, kids in middle school and high school, they're very much influenced by their peers, what their peers think and what their peers do. But I think this, you know, this just shows how important it is to, you know, to teach kids that not everybody smokes and drinks and uses drugs.
To educate.
To educate the kids that, you know, they may think it, but it's not actually true.
Yes, I think so. And, you know, I cannot tell that it is any close to be epidemic, because overall, alcohol and drug and smoking decreasing over time, you know? Yep. Kids drink less, despite all that. Over time, if you look at that, the kids in Massachusetts high schools, they drink less over time and smoke less. However, the education and programs are very important.
I've got your survey here, and I'm looking, and it says that under substance abuse, Hispanic students were more than twice as likely as white students to have used alcohol in their lifetime, 35 versus 17%. When you divide your results by race, by demographic, how do you avoid triggering racially charged reactions, or, yeah, how do you make sure that this stays, that the reason you're dividing it is solely to show demographic change and not to try and accuse any one group of anything?
I think that, you know, the main reason that we look at the data by race is to see if there are any disparities, you know, and so we can pinpoint, you know, which groups of kids are most in need of, you know, interventions or education.
Yes, and our goal is to close the gap. If we see the gap, we need to close it, right? And to target those subgroups. If we do not divide by race, if we do not know, how do we know? We have to. It is very far from accusation or something. It's a report.
Okay. And you mentioned how when you act based on what you find, what are some ways we could get some of these more troubling numbers on drugs down, and how we could get these positive numbers on fruits and vegetables up?
I think one of the main reasons that we distribute this data and these reports is for the other programs within the Department of Public Health to tailor their programs and interventions. By looking at the data, they can see what the biggest issues are, and they can have tobacco and drug and alcohol programs, and also things like the school lunch, and so other programs can see where they need to intervene.
Yes, that's important because based on our data, our programs in DPH, also superintendents looking at the statewide data,
Exactly.
that is a background for them, baseline, because they can see what's going on, what's going very good, very well, and what needs attention. So that's actually the main surveillance system. It is very important to have that data for everybody. And also I think for kids themselves, if they care, sometime to look at that, they can see. They can see, how they behave. What is their life in general, without going in person,
And you mentioned that people might want to take a look at the survey, which I've got here. We'll put a URL up on the screen where you can see that survey in just a moment. And Dr. Hawk and Ms. Gonsalves, thank you for joining me.
Thank you so much.
Thank you very much.
And we'll keep that up, but I'd like to say goodbye for Dan and Sophia. I'm Evan Berkowitz. Thank you all for watching, and see you next time on Wicked Teen from YBA.